Hi, I'm Surili.
Hi, I'm Seema.
Today we're thrilled to have with us Dr. Laalitha Surapaneni. Laalitha has been an assistant professor of internal medicine with a public health degree from Johns Hopkins Bloomberg School of Public Health. And she's a practicing hospitalist at the M Health Fairview University of Minnesota Medical Center in Minneapolis. She's a faculty advisor for health students for Healthy Climate and mentor of medical students in the Twin Cities Medical Society Public Health Advocacy Fellowship. She also currently serves on the Minnesota State Department of Transportation Sustainable Transportation Advisory Council. She's a member of the Minnesota Health Professionals for a Healthy Climate and is also involved in global health work. Welcome, Laalitha.
Thank you so much for having me, Surili and Seema.
Thank you for joining us. We're looking forward to talking to you about diverse interests at the intersection of health and climate change. Let's start with your background and tell us how an internal medicine doctor turns into a climate activist. And how did you get involved in the Line 3 effort? What was your journey?
Yeah, thank you so much for that. I grew up in India and very much with an awareness that, our health and the health of our planet are very, closely linked. And especially relevant was, if we damage our environment, we end up damaging ourselves. So even as a medical school in India, I could see that environmental health negative impacts were felt very disproportionately by low-income communities. So then I, moved to the U.S. and still I saw that BIPOC communities and low-income communities continue to bear those brunt of environmental impacts. And so I think for me, for most of my life, I really didn't know how I could make a difference other than, your individual personal actions until probably when I was in my internal medicine residency in Cleveland. So I remember this time where, I would come home from work and I would look out of the window, and on the left side, I could see the hospital, and on the right side, I would see a coal plant on the banks of Lake Erie that was just putting out smoke 24/7. And, I think somewhere along that time, it was very apparent to me that, I'm just caring for people and sending them right back into that environment that's probably contributing a lot to their poor health. And it was also apparent to me that I couldn't just turn off my lights in my apartment, and that's not going to, that's not enough to make a difference. And during that time, I think one of the first things for me was to try and figure out how could I engage in a bigger space. And one of the first things that I did was to look for others who were doing similar type of work. And that's how I actually came across Physicians for Social Responsibility. Started, seeing other incredible physicians who were doing this work. And I would say the same for, in Minnesota, when I started working here, it was getting engaged with health professionals for a healthy climate. And in Minnesota, specifically to Line 3, it was looking towards Indigenous leaders who are doing this work, and making sure that most of my work is focused on the leadership of the communities that are being impacted the most.
I appreciate that. I especially appreciate, how do you do this work in a bigger space? Mm-hmm. And that's what drives a lot of those advocacy interests in many people. So we understand that you are in Glasgow for the 16th Conference of Parties, the COP26, which, is a conference dedicated to solving the climate crisis. And there were countless pledges made to reduce, carbon and methane emissions, to phase out coal and more. Tell us what the mood was there when you were there. And do you believe that the gathering is a step in the right direction for global actions we need to address the climate and health crisis?
Yeah, so I was part of the university's delegation, and our official designation is observer. So I was part of what we call the civil society. So there's no like nonprofits, academics, health professionals, youth, indigenous activists. And I would like, if I could capture the mood in one word, I think it would be urgency. There's especially from speaking with other observers from developing countries, from island nations, and in the US from frontline communities from the Gulf Coast. There was this these are the communities that are already seeing the impacts and health impacts, especially of climate change from fossil fuel infrastructure. And so I think that was there was this sense that we need to be taking action. I would say, with all of the pledges that came out, you mentioned, I think there were several that stood out, and one of them was probably methane, right? Like the EPA said that they were going to start capturing methane during the leaks, but I think going back to that mood of the conference, I think the pledges that came out are probably not meeting the moment, because yes, we need to be making sure that we capture all of the methane from the leaks, but we really need to be talking about, when are we going to be shutting down fracked gas? When are we, starting to phase out fossil fuels? And I think there was this other mood of this very much disconnect between frontline communities that are facing the impacts and leaders who are not, getting action to a place where it actually meets the scale of the problem. So I would say that, definitely focusing even more on the actual policies that are being implemented and not the pledges that were made during COP26. I think that's where our bigger work is going to be.
Thank you so much for sharing that perspective. I really want to dig a little further on one of the comments that you made there about how it's not really meeting the moment, and how what's happening at the front line really may not be getting through. I understand that you had some involvement and advocacy around the Line 3. Could you speak to that? Because to me, that seems like a really good case in point of what you just mentioned.
Yeah, absolutely. So, Line 3 is a oil pipeline that carries tar sands oil. So tar sands oil comes from Canada, and it's one of the dirtiest fossil fuels, is very carbon intensive. So this pipeline goes from Alberta, Canada, through the headwaters of the Mississippi in Minnesota into Wisconsin, where the oil's refined. So this, one of the reasons that I got involved in advocacy against Line 3 was because of how big this pipeline is. It's we all know about the Keystone XL pipeline, so it's similar product, and it's also similar in capacity. So when we do the math, the impact of Line 3 is about 50 coal plants of emissions every year that this is in operation. And if this is a brand new pipeline that we're making operational in 2021, you can only imagine that we're locking ourselves into decades of emissions. And if climate is health emergency that we are all concerned about, I saw no other way but to be involved in this work, to make sure that we stop this pipeline, stop the emissions, and protect our health.
I love that. You're absolutely right. This is our actions today certainly have an impact on our health and our health outcomes for years to come.
Right.
And that's why advocacy matters. That's why making these changes matter. So for those who are less involved in the advocacy space, How can our listeners sitting at their kitchen table connect with the climate crises and the actions that are happening both at the global level, but also at the local level, like you just described with L3? What can they do about it to get involved?
Yeah, so I would say that, when we think about COP26 and climate change as at a global level, that's sometimes very overwhelming to engage with the problem all at once. But really, when we think about the impacts of climate change, right? So we know that our planet has already warmed by 1 degree, and we're already seeing the health impacts. And so when we think of those impacts, they're very local and they're different in like California, you may be seeing wildfires. Florida, you're seeing hurricanes. So for those who are, I think one way to engage would be to work on what we call adaptation, right? And that's a very much a state level, city and county level issue. And the other one, like I think we described with line 3, yes, while there are all these like global pledges that are being made, where that actually turns into action is at, once again, your very local level. How are you implementing your policies so that we actually meet our goals? And so even there, I would say that local action is the key. And so really for both these things, best way to engage would be system change. This is no longer a time when we can just talk about, change your light bulbs or don't get a plastic bag. We're way past that space. So I would say find your community, for me, it's physicians for social responsibility, it's health professionals for a healthy climate, but also find the frontline communities in your area who are leading on the work, who are showing us what the solutions are that work not just for climate, not just for CO2 emissions, but also for equity and for justice and for public health. And and let's get to work.
Oh, so much work ahead of us. I think that I would love to learn, and actually maybe love for you to be able to share with other clinicians on what that journey looked like. So, I know you mentioned different ways you got involved, but since this was such a unique track, what are other entry points? Where can clinicians turn to take action?
Yeah, I think that's a really great question. So I think of the different systems that we are part of. So policy is definitely one system, but as healthcare providers, we are part of the healthcare system. And we know that in the US, we contribute about 8 to 9% of our annual national greenhouse gases. And so one way for clinicians to be involved would be to work on our own kind of hospital carbon footprint. So that would be, how do you practice healthcare sustainably so that you care, not just for the patient in front of you, but also for the communities and the planet at large. I think there's also a really great place for us to be involved in many of the regulatory processes as well as legislature through our role as advisors. So for example, here I'm very lucky to be part of the Department of Transportation's Sustainability Advisory Council. And, just being part of that system, even though there was pretty much like, I had no knowledge about how does transportation policy work. And that was definitely very intimidating. But at the same time, I knew that, transportation is so intimately linked to health, right? Like the way we move ourselves. So it's not, again, just about reducing CO2 and just like moving cars from gas cars to electric cars. It's also about how do you create a community where you can bike and walk so you're healthy and that in the process like helps the planet as well. So I think there's those roles where we could bring our public health expertise into spaces where maybe that's not being considered at the moment.
I love how you're talking systems approach, because it seems overwhelming and daunting, but there are even higher, more upstream causes and determinants of health, right? So we often talk about the social determinants of health, but it's even bigger and broader, where we're looking at a lot of things like policy as a lever to pull, so we can level the playing field when it comes to access and opportunities that are linked to wealth and poverty, or structural racism, or economics. So I'm really glad to hear you talking about the systemic and the structural issues in this country. And I'm so grateful that physicians like you are out there, bringing your expertise with your deep understanding of the health impacts if we continue on the same way, the same path, and how that affects our generations. I'd love to give you, before we wrap up, just a minute to share any other nuggets of wisdom you can with our listeners about your journey, how they can even get involved in, whether they're a physician or not.
Mm-hmm. Yeah, I would continue to emphasize that, I think we really need to change our way of thinking from individual level actions to these system changes that will last for a longer time. Maybe they'll take a little bit of front end effort, but then moving forward, if for example, just you could convert your grid entirely into electric, you don't have to continually think about, every time you turn on the light, your action at those individual moments in time. So, find your community, find your front line, and work on system change issues.
Thank you so much, Dr. Laalitha. Thank you so much for joining us today and for sharing your wisdom. I also want to thank our listeners, and be sure to follow us on social media or check out our site. We will be posting more of these conversations with some of the amazing people who continue to inspire us, and hope that they offer you the same inspiration that they offer us.
Thank you. And until then, let's make some noise for climate. Bye.
Let's make some noise.
Bye.